So today we need to talk about Social Security and Medicare. There are some major changes coming in 2024, and I want you to be well aware of what you should expect. Now, just this week, we did see the new CPI numbers come out, which means that we now have the cost of living adjustment for 2024 regarding Social Security. That is 3.2%. I addressed this the other day, had a lot of people that were excited that the number was finally out, but there were many people that were extremely upset that why, if inflation is still up over 3%, we're actually at 3.7%, why is the cost of living adjustment much lower, which is only 3.2%? Well, the reason for that is because that's the way they calculate it. Now, what I can tell you though is yes, a lot of people are upset. There are certain lawmakers that are pushing for additional reforms regarding Social Security, some of which could potentially see an increase to your benefits, or could be an increase to the cost of living adjustment, but not in 2024. It would likely be in 2025. So we will address that later on as well. Now, let's just go over this. It says the Social Security recipients to receive 3.2% cost of living adjustment increase in 2024. We knew that this was coming. We had a pretty good idea that it was only going to be 3.2%, and that is the official number. That means more than 60 million Americans are about to receive a 3.2% boost to their benefits. Now, one person asked me the other day, how come more lawmakers are not pushing for an increase? Because, and I talked about this as well, if we are about to see a 3.2% increase to Social Security benefits, that's decent. That's not horrible, because again, it's been worse in the past. But if we're about to see a 3.2% increase, then how come, why in the world are lawmakers not pushing to ensure that Social Security is going to stay up with inflation? Okay, why is it not indexed with inflation? Because inflation today is 3.7%. It could go up to 4, maybe 5%. I don't think that's likely, but could it jump to over 4% in the next couple of months leading into 2024? Yes. And that would cause a lot of problems for Social Security recipients who are actually getting less. Okay? Just to give you an idea. Okay, just to give you an idea, look at this right here. So this is charts from Fox News. This right here shows the cost of living adjustments for the past 2 decades. All right? The average is 2.6%. You can actually see it down here. The average over the past 2 decades is 2.6%. This year it will be 3.2%. Look at this. So in 2024, right here, it's 3.2%. In 2023 is 8.7%. In 2022 is 5.9%. And then again, these are the COVID years. 2021 was 1.3%. 2020, 1.6%. 2019, 2.8%. It was 0% in 2016, and it was 0.3% in 2017. So as you can see, these were terrible years for an increase, and obviously these ones are a little bit better. So 3.2% is not bad. It is above the average over the last 2 decades. Now, what is happening? Well, what we know is that lawmakers are trying to push for certain things, certain pieces of legislation. One of those is to increase the Social Security tax cap. Currently in 2023, it is set at $160,200. In 2024, it will be higher. Look at this. It says higher earners should be prepared to pay up. On October 12th, the Social Security Administration announced a number of key changes to the program include an updated wage cap for 2024. And that wage cap is $168,600, which means it went up $8,400 in 1 year. Okay? It says in light of this change, workers with income equal to or beyond the new wage cap will have to pay a total of $20,906.40 in Social Security tax in 2024. That's an increase of $1,041.60. Now, this right here, this tax, that is 12.4% of that number. Okay? That's where they're getting that number. So again, just understand that yes, even though President Biden has said nobody making under $400,000 per year would pay a penny more in taxes, he, I guess, does not account for the Social Security tax cap increase. So, it is what it is. Now, let's get to Medicare. The reason why I want to talk about Social Security and Medicare is because these are two programs that millions and millions of Americans rely on just to live, for their livelihood. Okay? Here's what we know as of today. The Medicare premiums are set to rise in 2024. Sorry to say that, but they are going to increase. We knew they were going to increase. Now, I want to read you this. Okay, this is a article from Axios. I want to read you this right here. It says the big picture. Though inflation pressures are receding, projected growth in healthcare spending is continuing to drive up the cost of care. A plan to repay providers for underpayments they received from a federal drug discount program is another factor. Now, this is a big one right here. Healthcare spending is going to continue to drive up costs. It is. And because costs are going to get more expensive, Medicare will get more expensive. Let's look into some of the numbers. It says the standard monthly premium for traditional Medicare Part B coverage, which encompasses physician care, outpatient services, and medical equipment, will be $174.70 in 2024. This year in 2023, it's $164.90. So obviously an increase of $9.80. Says Medicare enrollees may see higher premiums based on their income. The annual deductible for all Medicare Part B enrollees will be $240, an increase of $14 from this year's $226. Again, that's an annual deductible. So the deductible for Medicare Part A, which covers inpatient hospital care, nursing home stays, and other services, will be $1,632 next year, which is $32 or a 2% increase from this year. So again, it's not huge, it's not a insane jump, but it is something. Now, a lot of people were saying, well, why did Medicare go down in 2023 from what it was in 2022? Shouldn't it continue to go down? No, because of this, okay? I want to show you this. It says in 2020, Medicare Part B premiums rose by 15%, largely due to a hefty anticipated price tag for Aduhelm, the controversial Alzheimer's treatment. But Medicare's subsequent decision to limit coverage of the drug allowed premiums to come down about 3% for 2023. Keep in mind, in 2020 or 2022, they were charging for that. All right? So that's the reason why it came down in 2023, not because healthcare was less expensive. All right? Because just look at, let me just read you some numbers here. And this is why many lawmakers are pushing for additional increases to Social Security, because they understand that if we do see inflation continue and pass the 2%, well, the problem is if that happens, people are going to be paying more money. Keep in mind, right now, the Social Security cost of adjustment is only 3.2%. So if inflation is up over 3.2%, that means Social Security recipients are actually getting less than what inflation is. Okay, so they're being hurt more. They're being squeezed even tighter. Just give you an idea. From August to September, all right, food prices increased by 0.2% month over month. That is, if we extrapolate that for the year, that's 2.4% year over year. Energy costs were up 1.5% month over month. This is from August to September of 2023. Annualized, that's 18%. Shelter was up 0.6% month over month. So annualized, that is 7.2%. These are things that seniors and people on Social Security, these are things that they buy, right? Food, energy, okay? So utilities, gas, things like that. Shelter, got to have a home, someplace to live. And medical care services. These are up 0.3% month over month. Annualized would be 3.6%. Again, all these except for food. Food is the only thing that came down. It was at 2.4% annualized, but energy, shelter, and medical care services, these were all higher than the cost of living adjustment for 2024, which is 3.2%. So, just wanted to fill you in on what's going on at this time. Again, major changes are coming to Social Security and for Medicare in 2024. As we get more information on any of this stuff, I promise I'll fill you in on all the latest news and updates. All you got to do is two things. First, hit the like button if you enjoy these daily updates. Also, click that subscribe button so you never miss an update. And I will see you guys on the next one.